48 people died and more than 700 were infected last fall after being injected with contaminated steroids. Vials were shipped to 23 states from a pharmaceutical company called New England Compounding Center. On last night's 60 Minutes, Scott Pelley investigated the lack of government control.
NECC was growing explosively, and so was the compounding industry. It started in 1998. When Congress exempted compounding pharmacies from the oversight of the Food and Drug Administration. The theory was mixing drugs one prescription at a time shouldn't require federal inspection. The law passed over the strong objections of then FDA Commissioner David Kessler.
You, as FDA Commissioner, testified before them and you said, don't do this.
If you're not going to have oversight, one day people are going to die.
That day's arrived.
This should not happen in 2013. Maybe at the turn of the previous century, where we didn't have institutions like the FDA, there is no reason why people had to die.
Without FDA supervision, compounding took off. State health departments are responsible for regulating what is now nearly a $2 billion industry. Dr. Margaret Hamburg is FDA Commissioner now, and she told us because of the 1998 law, she doesn't know how many compounders there are or what they're making.
You know, I can just hear the folks at home saying, wait a minute, I thought every pharmaceutical drug in this country was approved by the FDA, and you seem to be telling me in this interview that that's not the case.
Well, compounded drugs are not FDA approved.
So if a patient goes into a clinic and the doctor or the nurse pulls out a vial of something, that patient has no way to know whether that drug has been approved by the FDA or not.
Well, I think that's right under the current system. And what I think emerged in the meningitis outbreak was that many patients and their healthcare providers didn't realize that they, in fact, were using a compounded product.
As Commissioner of the FDA, then, you can't tell us, sitting here now, that every drug being used in the United States is safe and effective.
No, I really cannot.
This past fall, officials inspected NECC. The FDA tested 50 leftover vials. Each one was contaminated. NECC is now the target of a criminal investigation.